A figure of the toll of infections, which can be used as an indicator to show that the curve has been flattened? And how long after achieving that can we consider lifting the MCO, and what are the factors to be considered before it is done? Thanks.
Okay, when we look into the testing, for example, I was informed in Guangdong for 110 million population, they are doing a testing about 30,000 testing a day. We are doing our capacity testing initially was 11,500. Now we have increased our capacity to 16,000. And yesterday, we managed to do 13,614 cases, sample a day. So which means that we are pushing our capacity to 16,385 from 43 labs that we have. So that's one. Second is that when we look into the capacity of the testing now, we are trying to optimize our testing. So we have two centers, is IMR. We are going to install the BGI. There is a Beijing Genome Institute automated testing. So that will give us an increase of 5,000 testing a day. And we are also going to install in Makmal Kesihatan Awam in Kota Kinabalu the BGI testing, automated testing, and that will give us another extra 1,000 testing in Sabah. So I think we are increasing the capacity of testing. What we are talking here about, we are addressing is RT-PCR. So this is the gold standard of us to diagnose COVID-19. If we were to look into our modeling, our Ministry of Health, our RO, that means R0, that is infectivity, before the MCO is about 3.55, which means one individual will infect 3.55%. But now, after the 14th of April, we have brought down the RO to less than 1, R0 to less than 1. And now it's certainly less than 1, and we are seeing the cases, the infectivity cases now. Now, if you were to look into our infectivity cases, infectivity cases ataupun keboleh jangkitan, today we have 1,932, less than 2,000. So we hope that the cumulative positive cases that we have, minus those discharged and minus the death, then we have the cases that is actually a positive cases, and all the 1,932, we admit them, we observe them in our hospital and make sure that we can control the infection. And we continue to test them until they are negative, then only we discharge them. So this is the action of if you can actually trace and then you confirm the cases, and once you confirm, you isolate them and you treat them. Then that shows that the infectivity of in the community is less than 1 now. But more importantly is that for us to continue to stay at home, if you do, that helps us in terms of to reduce the infectivity in our community. So that's where I think we are looking into today. That is actually the cases have been reduced to 2 digits, but we hope another week or 2 we will be able to reduce it further. So that is our intention, and hopefully by doing so we can actually perhaps control COVID infection in our hospital and in our community.